My name is Charl Els and I'm a clinical professor in the Department of Psychiatry, and I'm appointed as a physician educator in the Division of Preventive Medicine, Department of Medicine at the University of Alberta. This session focuses on the issue of violence at work. Thank you to the WCB of Alberta for making available funding for this project. There are no conflicts of interest to declare, and the opinions expressed in this presentation reflect those of the speaker and not necessarily those of any collaborator or funding agency. The session focuses on a brief overview of the issue of violence at work, and at the end of this session, participants will be equipped to cite the prevalence of violence and bullying at work, identify risk factors for violence, and outline measures for prevention. So what is workplace violence? A widely encountered definition is that it refers to any act or threat of physical violence, harassment, intimidation, or other threatening disruptive behavior that occurs at the work site. It varies in severity and in consequences. It could be fatal or non-fatal. A broader definition includes elements like nuisance, robbery, aggravated or simple assault, conflict and hostility, all while at work. The impact certainly is broad and far-reaching, affecting employees, clients, customers, visitors, society at large. However it manifests, workplace violence is a major concern for employers and employees. The prevalence varies greatly across different work settings. Canadians are exposed to a lot of violence, and half of workers report that they have been bullied at some point in time at work. This is not frequently reported. Statistics Canada suggests that more than 70% of workplace violent incidents are classified as physical assaults. Homicide is currently the fourth leading cause of fatal occupational injuries, and about 10% of fatal workplace injuries are due to workplace homicides. 80% of homicides in the workplace are attributed to criminal activity committed by individuals unrelated to the workplace. Men and women are equally likely to report having experienced workplace violence. When asked, about 33% of persons with mood disorders attribute their mental problems to their work situation. Workplace bullying may be related specifically to one's tasks and can take the form of unreasonable deadlines, meaningless tasks, or excessive monitoring at work. And this becomes a source of distress, which can impact immediate psychological and physical health, subsequent health, including depressive anxiety disorders as well as PTSD, as well as leaving the victim with a decreased sense of well-being and lower job satisfaction. This can result in an adverse impact on job performance and indirectly with an impact on company bottom line then. Workers who are exposed to bullying at work often report reduced commitment to the workplace and to the employer, higher levels of sickness absenteeism, as well as increased psychotropic drug use. Bullying at work is a significant predictor of adverse health, including psychological outcomes. What about violence in the health sector? One particular sector that's especially impacted is that of healthcare. In these settings, murder is rare, but violence is not. It's actually been described as an epidemic, one that's ubiquitous and persistent. The majority of violence in the healthcare setting is verbal, but it also includes assault, battery, domestic violence, stalking, sexual harassment, and others. Workplace violence against healthcare workers is rampant, and solutions remain unclear, largely as a result of under-recognition, under-reporting, as well as the problem of poor quality research. What are the risk factors for violence? Well, research has indicated and have identified factors that may increase the risk of violence for some workers at some uncertain work sites. Exchanging money with the public and working with volatile, unstable individuals are risk factors. Working alone or in isolated areas may also contribute to the potential risk for violence. Providing services and care and working where alcohol is served increases risk. Additionally, time of day, location of work, for example, working late at night or in areas with high crimes, are also risk factors. Increased risk occurs among delivery drivers, healthcare professionals, as said, public service workers, customer service agents, law enforcement personnel, and those who work alone or in small groups. Individual risk factors include age, 35 years and older, gender, men more so than women in terms of risk, although reporting seems equal, past history of trauma, abuse or neglect, educational underperformance, low IQ, and previous interface with the law are also risk factors. Finally, and perhaps one of the most salient individual risk factors is that of substance abuse, specifically stimulants and alcohol. What are the consequences of workplace violence? Well, injury, which could be physical or psychological, absenteeism, loss of productivity, in other words, presenteeism, and increase turnover of staff. The risk to the reputation of the employer is salient as well. And if the employer gets a reputation for not offering a safe workplace or work environment, it can significantly tarnish any industry. And if proven, it can result in legal exposure. Also, there are medical costs, claims for reimbursement for the injury, psychiatric counseling, funeral costs. Productivity could foreseeably be impacted, damage to the property or diminished sales. And there's, of course, the issue of legal fees to the employer to remedy psychological and other injuries. And psychological injuries is in fact the fastest growing claim area in workers' compensation areas. What can be done? Well, there's no magic bullet, and prevention certainly is the main objective. Addressing workplace violence should be collaborative and iterative. Risk is modulated by organizational culture, and good starting points may well be 1. Declaration of a zero tolerance for bullying policy, and then any other form of violence should be included, for example, sexual harassment. A formalized and proactive approach is recommended instead of reactively dealing with complaints of bullying, harassment, or waiting till homicide occurs at work. Identifying individual risk factors and providing mechanisms to address those are critical in ensuring workplace safety. Management needs to secure a commitment and ensure employee participation in any such strategy. This formal approach usually consists of first conducting a proper worksite analysis, determining current status, followed by identification of target areas to address, and a formal implementation strategy for hazard prevention and control. The requirement for safety and health training, as well as record keeping and program evaluation, are also critical elements. The Mental Health Commission of Canada established a national standard for Canada for psychological health and safety in the workplace, also referred to just as the standard. It's the first of its kind in the world, and it's a set of voluntary guidelines, tools, and resources intended to guide organizations in promoting mental health and to prevent psychological harm at work. Standard helps organizations with productivity, financial performance, risk management, organizational recruitment, and even employee retention. Workers obviously have a right to a safe workplace. Whichever way it manifests, workplace violence, including bullying, is a major concern for employers and employees nationwide. No solution, no single one-size-fits-all remedy to this. Prevention is key. Increased awareness of risk factors, both systemic and individual, against the backdrop of a zero tolerance of any violence policy, may well be the most solid first step. Evidence-based prevention programs are available and recommended for implementation. We've included a list of resources which I hope would be helpful, and we look forward to your feedback and comments, and please help us identify future topics for further discussion. Thank you.